I do want to do a special thank you to MDRS's Amy Shirley for doing our signing today. The agency is always great in providing signing for us, and we are most grateful. So as you all know, vaccine eligibility is open to those 16 and older today. And that, of course, is our lead story. But we actually have a lot of items on the agenda to discuss as well. So joining us today is State Health Officer Dr. Thomas Dobbs, and he is going to discuss the new vaccine eligibility. State epidemiologist Dr. Paul Byers will discuss case numbers and numbers regarding our vaccination efforts. We have actually been very, very successful at reaching our communities that we wanted to reach in the age groups, and also our at-risk communities, which segues nice to Dr. Victor Sutton, who is a new addition to our press conference, but not a new addition to the COVID effort. He leads the Health Disparity Branch. And then we'll hear from Jim Craig, last but certainly not least, our Senior Deputy and Director of Health Protection, who is going to talk about all the different testing sites. That's part of the reason we're able to open this, because we have so many testing sites available. And also he's going to talk specifically about the Pfizer vaccine and where and how you can get that, because that won't be available at all of our sites. So right now, with this packed agenda, I am going to throw it to you, Dr. Thomas Dobbs. Let's talk about the new eligibility.
Thank you, Liz, and thank everyone for joining us. As you're aware, the governor announced yesterday that vaccine eligibility is open for every Mississippian age 16 years of age and older. We're excited to be able to open up this eligibility because we know there's a lot of demand out there. We've had phenomenal success in getting vaccine out to different parts of our population. Obviously, we've tiered it out initially for mostly high-risk folks. And Dr. Byers will talk about what a good job we're making, what progress we're seeing in our older individuals, our 75 plus, our 65 plus. And we know these are the age groups where the majority of the severe illness and the deaths occur. So certainly it's the right time to do it. We need to get as many vaccines administered as quickly as possible. And we've already got appointments scheduled out some weeks ahead. So we see that it may be a couple of weeks before a lot of folks will be able to get vaccines, but now is the time to open it up so that we can maximize the delivery and the administration of these vaccines. As far as the 16 to 17-year-olds, right now only Pfizer is appropriate for individuals in that age group. And so I think Jim's going to address that. We do have a mechanism to make sure that 16 and 17-year-olds can get referred for the Pfizer vaccine. I think we've had a rather phenomenal process, especially through our drive-through locations. I think the Department of Health team and the National Guard have done phenomenal work, not only in productivity, but efficiency and in customer service. And I would like to use this as a model for our agency operations going forward. Very, very proud of our teams. The other thing I did want to mention real quickly is we have launched the Center of Excellence program. About 2 weeks ago, we started a program where we partner with different hospital health systems to try to help supply critical community needs. And to become a member of the Center of Excellence program, you have to agree to participate in 3 key elements. One of them is going to be supplying vaccines to the general population in the community, not just your patients, but all comers. Also included is the provision of the monoclonal antibody, like the bamlanivimab or the Regeneron, and being a referral site. So local physicians can refer in if they have a high-risk patient who needs immediate access to that treatment. And the third thing is working to address health disparities in your community. Right now, we have 43 different hospital health systems enrolled in the program. And today we will announce the addition of those 4 are new ones that have not yet been published, including Alliance Health System, Forest General Hospital in partnership with Hattiesburg Clinic, Noxubee General Hospital, and Winston Medical Center. So we'd like to express our gratitude for them joining the effort. They've done phenomenal work. And as a quick sort of shout out, a lot of these folks are doing great work. Not to say that everybody's not doing this level of wonderful activity, but as an example, St. Dominic's got an update today. They're going to schools, they're going to churches, they're going to homeless shelters. They are getting vaccine where it needs to be given. So a combination of the high efficiency of the drive-through locations run by the Department of Health and National Guard, and then our fantastic partnerships is really going to help us move the needle and get where we need to be, not only with vaccinations, but with beating back the COVID pandemic. So that's all I have right now, and I'll go ahead and turn it over to Dr. Paul Byers.
Hey, thanks, Dr. Dobbs. So today we're reporting out an additional 369 cases and 27 deaths. I know we have talked about for a number of weeks the declines that we've been seeing in both our case numbers and deaths, and this has been very encouraging. We've continued to see those declines, but as we've talked about before in our case numbers, it looks as if we are having some leveling off. Um, the number of deaths we're seeing now with the decreases is encouraging. We're seeing a decreased impact on our nursing homes, and certainly that's been very welcome. In the week ending March 10th, we actually recorded no long-term care or nursing home deaths, which is a huge win for us. And our total number of nursing home outbreaks is now below 40 statewide and continues to drop. But it's important to understand that even though that we've made some great success with our vaccine efforts, and we'll talk about that in a second, but also seeing the declines in the number of cases and the decreased impact in deaths. Certainly we're seeing decreased hospitalizations. We're seeing our syndromic surveillance dropping. All of those are great indicators that we've continued to move in the right direction. I do want to remind everybody that now is not the time to be complacent. With the increased eligibility for all Mississippians over the age of 16, certainly we encourage everybody to get vaccinated. But we also want to remind everybody that when you're in a public place, it's still a good idea to wear a mask. It's still a good idea to gather in smaller groups. And remember now that it's even safer when folks are fully vaccinated. And remember to physically distance. And if we all continue to do those parts, we can see that curve continue to decline along with our vaccination efforts. We've talked about the impact of COVID-19 on our older individuals, especially individuals over the age of 50. And we know that those age groups account for about 90% of the mortality that we've seen associated with COVID. And so we have made concerted efforts to vaccinate those age groups. And we know that those people 65 and older, and even more so the individuals 75 and older, have been greatly impacted. If we look at the estimated percent of vaccination for those age groups, based on the estimated population for those age groups in Mississippi, we have now vaccinated almost 60% of our 75 and older individuals with at least one dose of vaccine. Additionally, 43% of those individuals over the age of 75 have completed and are fully vaccinated. These are great strides to continue that effort to minimize the impact on this vulnerable population. We look at our individuals 50 and older, 43% of our total estimated population of 50 and older have received at least one dose, and of those 25% have been fully vaccinated. So we're continuing to make gains in those age groups. And if you fall in those age groups, I would encourage you to continue to reach out to get vaccinated. If you have a family member who's in one of those age groups, please help them get vaccinated. As we've done in the past, we're updating our website with the sites in Mississippi where you can look. It's an interactive website where you can find a site close to you that's either a pharmacy or a hospital or clinic or a MSDH drive-through where you can get vaccinated. When we look at our total doses administered for the state for today, in Mississippi, we've administered over 900,000 vaccines. And of those, about 330,000 Mississippians have been fully vaccinated. Almost 600,000 Mississippians have received at least one dose. We did add some data to our website today that list the total doses administered, the total number of people receiving at least one dose, and the total number of people who are fully vaccinated by county. I would encourage you to look at the website and review that data. It's important to understand what each one of those mean. These are the number of doses that are administered by county of residence. So that means this is where these individuals live, not where they were vaccinated. So the number of people receiving at least one dose, that includes either one dose of a Pfizer or Moderna vaccine or one dose of the Johnson & Johnson. The number of people who are fully vaccinated includes those individuals who have received two doses of a Pfizer or Moderna vaccine, and because it's a one-dose series, only one dose of the Johnson & Johnson. When we look at our racial data that we have for vaccination on our website, and I would encourage you to look at that. Right now, since we started our vaccination efforts that have been ongoing since mid-December, 27% of the total doses administered in Mississippi have gone to African Americans. Just a bit over 60% have gone to white individuals. I would encourage you to look at that data. We will soon publish this data on our website, but when we look at the total number of doses administered by race over time, this last week, the week ending March 13th, 38% of our total doses administered were among African Americans, and 51% of those total doses administered were among white individuals. So I would encourage you to continue to watch our website. We will continue to update the information, provide additional clarity and granularity of the data that we're reporting, and make sure that we're getting accurate and timely data out. So Dr. Dobbs, that's everything for me. Thank you.
Okay, Dr. Sutton, again, welcome. And can you talk to us? You have been leading our health equity branch in the COVID response effort. So you have a lot of exciting stuff to talk about. Would you be able to share that with us now?
Sure, I'd be glad to. I think one thing that we found out early on is issues around access and making sure that it's available statewide, especially to vulnerable populations and those at risk. Well, we're excited to getting ready to launch our new partnership that we have with community health centers. We're going to be partnering with 6 community health centers. And so we're going to make it available through our hotline that you can call our hotline and press 2 and ask for it, that if you want, if there's a church, there's a community organization, if there's other partners in the community that want to host a vaccination site or event, we're gonna get that name, that contact number, that organization number, and work towards having that event in that community. That's going to be statewide. And so this is a partnership that we're partnering right now. We're working with 6 community health centers across the state. We plan to increase that number, but it's a way to bring down the barriers and provide greater access. We have a lot of access points around the state, and as Dr. Dobbs mentioned, we're increasing that. But now we have the opportunity to reach rural areas, reach specific populations and specific communities. And so we're excited to do that. And it's going to be a process where you just contact us, give us a name, an organizational number, and we're going to work towards that end. We've had some great success as it relates to testing, and using that as a model, and working with community partners who our Hispanic community, our Vietnamese community, and working with those particular groups and targeting particular groups. And so we see this as the other extension to that on the vaccination side, because we're still doing testing. but we know that the opportunity here is really in the vaccine. And so this is going to be an opportunity for us to kind of continue that. We continue to work with our churches around the state. We are working with our Head Starts around the state. We're working with our HBCUs and doing some different things there. So we're excited to bring this to bear and continue that work and to continue to increase some of our disparate numbers and address some other challenges as we have in reaching this population. And that's where I would leave it for now. And I'll toss it back to you, Liz.
Thank you, Dr. Sutton. And now we would like to have Mr. Jim Craig talk about all the vaccination sites and also specifically about how to go about getting those Pfizer vaccine appointments. Jim?
Oh, thank you, Liz, and thank y'all for being with us today. There are obviously many opportunities in Mississippi to receive COVID vaccination, and those do include our 24 state and county drive-through vaccination sites. In fact, to help improve access, especially in our Mississippi Delta area, we have county sites in Coahoma County and Bolivar, LaFleur, Washington, Warren, Sharkey County that's actually covering both Sharkey and Issaquena. And starting next week, we'll be operating a site in Claiborne County, and it will be hosted by Alcorn, and it will be at the university for that site beginning next week. COVID vaccination is also available through many of our healthcare partners and providers that have enrolled in the process, and many pharmacies in the state. There's a federal pharmacy contract that is providing some of those vaccines, as well as some through our partnership program are being provided vaccine to provide to individuals in Mississippi. As Dr. Byers mentioned, there's a great map that is on our website at www.healthyms.com. It shows the locations of where these vaccination sites are, be it a healthcare provider, a pharmacy, or one of our state or county drive-through locations. This morning, we released over 37,000 appointments through the state COVID vaccination site. That system can be found at covidvaccine.umc.edu, and appointments are out there and available this morning. As far as the Pfizer, just so you can understand where some of the Pfizer locations are, our state and county drive-through locations at DeSoto County at the Landers Complex, as well as Oxford's Readiness Center, in Lee County at Barnes Crossing, at Lowndes at the Fairview Baptist Church, Smith Wills here in Hines, Canton High School in Madison, Trustmark in Rankin, the Coliseum in Neshoba, the Magnolia Center in Jones, and Lake Terrace Convention Center in Forest are all currently operating Pfizer sites. Starting next week, we will add 3 additional Pfizer sites, that being the Civic Center in Panola County, the Mississippi Coast Coliseum in Harrison County, and the Fairgrounds in Jackson. For those that are 16 or 17 years of age, appointments cannot be made online. They have to be made through our call center. So calling the hotline and selecting the 16 to 17 appointment plan will get those appointments made at a Pfizer site. Pfizer is currently the only vaccine approved for those 16 and 17 years of age. If we look at testing, just a quick update on that. Our testing numbers are down a little bit. I think that reflects in some ways to our caseload that we've seen and our hospitalizations going down as well. But testing is still available. Free testing is still available here at the Capital City location, at the Farmers Market at the corner of West and Woodrow Wilson. And it's open 7 a.m. It's open 6 days a week, Monday through Saturday, for testing for COVID. With that, Liz, I'll kick it back over to you for questions.
Okay, thank you, Jim. We'll start out with Susan. Speed is county of residence, the county the person gives as their address or where the vaccine was administered. That would be their address. So you were right about that. On people receiving at least 1 dose, that looks like it must be only partially vaccinated people and does not include the fully vaccinated, correct? Let's see. Dr. Dobbs, do you want to take that?
Yeah, I think Dr. Byers can better explain it.
Okay,
That's not quite right, I don't think. Yeah.
Yeah, no, so the people who receive, when it's listed as those individuals who've received at least one dose, that's individuals who've received either one dose of Pfizer or Moderna or the one dose of Johnson and Johnson. And these are the folks who've gotten one dose of any vaccine. And then the number of folks who've received or fully vaccinated includes individuals who've only received the one dose of Johnson and Johnson, but also individuals who've received two doses of the other vaccine. So it's at least one dose and it's completely vaccinated. And those individuals who received Johnson and Johnson are included in both categories.
okay, thank you. And then Susan also asked, which category does Johnson and Johnson vaccine recipients go into? I'm not sure how she's asking that, but once again, will you take that, Dr. Byers?
Yeah, they're in both categories because they've been fully vaccinated and they've received one dose.
All right, thank you. Y'all have been asking me about permission to record. I don't have that ability at this time and have not had it since we began these Zoom press conferences. So we do record it and you'll find it later on today on our website. So sorry about that. Patrick McGee, Sun Herald, how many samples per week is the state testing for variants? Also, has the state seen a recent increase in the appearance of variants? Dr. Byers.
So we're testing about 75 samples a week, but we're going to be significantly increasing that in the coming weeks to increase our surveillance through a number of mechanisms. We have seen variants identified in Mississippi. We've identified 9 cases that have been infected by one of the variants of concern. These have been the B117 variant or the UK variant. We've not identified any of the other variants of concern in the state to date, but it is important for us to continue these surveillance efforts, and we're in the process of ramping up our virologic surveillance to be able to identify additional occurrences of variants in the state, which we do expect.
Okay, thank you, Dr. Byers. I think we talked, Bradley, about the vaccination sites, but write me back if you have more specific questions, hearing Jim Craig do his presentation. Okay, Clarion Ledger, does doses administered drop from March 6th to 13th by about 10,000, but eligibility widened? Why is that? Have we seen the peak of vaccinations? Gentlemen, which one of you?
I'll start, but I'll let Jim help out and Paul too. So we did see a massive jump because we had to reschedule folks from the ice week, from the ice storms. And I think that accounts for a lot of it spaced out over those 2 weeks. But the other factor is we had a lot of Johnson & Johnson made available immediately. And so there's going to be sort of a temporary bump for those couple of weeks based on the residual doses that were unable to be used during the ice storm and the increase in the Johnson & Johnson we got 24,000 doses and then we got 0 that next week. So I think, it's pretty obvious the supply was sort of variable for that period of time.
Gentlemen, would either Jim?
And I think that's spot on. I think the increase in the Johnson & Johnson product was part of what we saw, but the whole reschedule of the almost a week that we were shut down in the drive-through operations because of the ice and snow event, it has been part of the inflation in the numbers.
Okay, Dr. Byers, anything to add?
No, I think they covered it well.
Okay, the next question from the Clarion Ledger. What was the consultation like between the health department and the governor's office over the decision to make eligibility for all Mississippians? Dr. Dutz, I think you all had great communication.
Yes, we meet with the governor on a regular basis, and he gets daily reports on, vaccine utilization. He looks at the number of appointments available for what duration of time by location throughout the state. So he's very well informed, and we'll go over it together, and and we'll recommend, when it's time to consider these things, and based on the numbers, the governor makes the call, and we're excited about this. We think it's the right time.
Thank you. And Jim Craig, tomorrow's predicted storms. I know I interrupted you right before our press conference. You were working on that. Can you give us some guidance on that?
I can, and this is kind of, I guess, late breaking. We just completed a call right before this press conference with the National Weather Service and MEMA, really looking at all of the impacts that could potentially that we could see throughout the state with some very severe and dangerous weather tomorrow. So really, because of this threat and for the safety of our patients and our teams, our 24 state-sponsored drive-through vaccination sites will be canceled tomorrow, March 17th, 2021. So any of the individuals that have appointments at any of those state-sponsored drive-through vaccination locations are being automatically rescheduled and will receive notification of their new appointment dates by either email, text message, or phone. Their appointment will be at the same location at the same time, but they'll receive the new date through that email address, cell phone, text, or a phone call from the numbers that were listed in their appointment. No actions required on the part of those individuals that are being rescheduled.
Okay, thank you, Jim. I believe, Shalini, Dr. Sutton gave us a great overview with this. How is the MSDH working with vulnerable communities in hard-to-reach areas on the coast? Dr. Sutton, would you like to add anything to what you have said?
Sure. One of the things that we're doing is that we're working with Coastal Family Health Center. And so we're going to work with them in conjunction with what I mentioned earlier about the hotline. And so we're going to be able to target specific populations, specific groups to provide the vaccine in that particular community. So we're excited about adding that to outside of just the sites that we have available on the coast. We're going to have this partnership that we're going to be able to work with specific groups and targeted groups to go into communities and provide them in that community. So we're excited about that.
Thank you, Dr. Sutton. What accommodations arrangements are being made to prioritize and distribute COVID-19 vaccinations to MDOC employees and people in prison and jail in Mississippi? Well, Brittany, we have been working on that since the beginning of the COVID effort, and we also help with outbreaks and guidance as well. Dr. Byers, why don't you explain how we've been working with the prisons?
That's such a great question, and this is a vulnerable population in a congregate setting that we want to make sure it gets vaccinated appropriately as well. And so we have been working with the Department of Corrections here in Mississippi to provide them with the doses of vaccine that they need to be able to not only vaccinate the staff and the MDOC employees, but also those eligible inmates and detainees who are ready to be vaccinated. And we're going to continue to provide them with the vaccine that's needed until they're able to offer vaccination to every individual who wants it and is ready to receive it. We've also worked with a couple of the private prisons in the state to be able to provide them with vaccine. We're working on some planning now, and we've already worked individually with a couple of county jails, and we're working on some planning to be able to expand and provide vaccine and support to county jails, hopefully in a sustainable effort and sustainable manner where we continue to get those employees and the inmates and detainees vaccinated. So our planning is ongoing. Some parts of it have already moved forward, and we're going to continue to hammer away at it.
Okay, thank you, Dr. Byers. Kobe Vance. Currently, many of the vaccinations are performed at the drive-through sites, but we have added, as you know, Kobe, a lot of providers. But time and time again, as Mississippi has expanded eligibility, the demand eventually declines. What is the state's plan for distributing vaccines and keeping demand up now that all residents over 16 qualify? Well, first of all, Kobe, that does open it up to a lot of people that were not eligible before, a lot of healthy people of a younger age. I'm going to ask Dr. Dobbs, do you want to take that first?
Yeah, no, it's a great question. We've been highly successful at these high throughput drive-through models, but for many people that's quite inconvenient. There are a couple of factors. Part of it's going to be, it's during the working days, right? And so that can be an impediment. We also know that transportation can be a challenge for some folks, and some people just don't want to drive that far and they're waiting. And so we do think there'll be considerable demand for the drive-throughs going forward, but we know there's other efforts that are going to be very important. We've already have some partners working with industry to do worksite vaccinations. That's going to be huge. We have a lot of folks who are working to vaccinate at schools. That's going to be immensely helpful. Like Dr. Sutton's efforts with community health centers, reaching people where they are for the churches. And then in doctors' offices, because we still know we have pretty good data that show that there's significant demand based on the number of people who really want to get vaccinated. It's for us to lower the barriers and to bring vaccine where people want to go. And a lot of people are waiting to get it at their doctor's office. That's where they feel most comfortable. So addressing every possible avenue to make sure people can have access to vaccine is going to be the way that we go forward. What you're seeing now is more and more vaccine going to private doctor's offices. You're seeing more go to pharmacies. So the options are increasing very quickly. And pretty soon people are not going to have to go to a drive-through site. They're going to be able to get it through the traditional mechanisms, and that's going to be a good thing. We want people to be able to access their healthcare services through the normal medical delivery system.
And Jim, percentage of vaccines going out to the drive-throughs, it was my understanding previously providers were actually getting more of the vaccines than our drive-through sites. Is that still true?
So I think Dr. Byers has some of the latest updated figures on that percentage. Dr. Byers, you have those in front of you? I don't have it in front of me.
I do. So, our allocation from the federal government for the number of doses that we're receiving for Pfizer and the number of doses for Moderna, even though our number of Johnson & Johnson was a big surge at one time, it dropped off quickly, and the number of doses we're getting from Johnson & Johnson are very small allocation now. But less than 50% of our total doses allocated are going to our drive-through clinics to support them. And the remainder of that vaccine is being distributed out to our partners, of which we have over 1,200 enrolled providers in the state. We work every week to provide as much vaccine as we can out into those communities based on the capacity and the ability to handle the vaccine. So we'll continue to do that. We anticipate as those allocations grow that we'll be able to provide more and more out to our partner providers.
Okay, thank you. The American Rescue Plan, what about this can help us improve the vaccine process in Mississippi or any response to the pandemic? Jim Craig, can you?
Well, it's a new piece of legislation. There's a lot of details that we're waiting for the funders to tell us exactly what the rules are going to be for using these funds. But obviously, it should be a great benefit as we continue these vaccination efforts in our state.
Okay, thank you. Let's see. Now that you are opening up to more people, what are you going to do to ensure that folks in rural areas are getting the vaccine and not just the people in the metropolitan areas? I think, Shalina, we have laid that out for you perfectly. Dr. Sutton has done that. And remember, our centers of excellence and our community health centers that are going to be working with these churches are working in areas that are harder to reach. Dr. Sutton, would you like to add anything?
And Liz, I'd like to also add, that's one of the reasons we target our clinics. Like, I want you at our website and look at the hundreds of clinics that are targeted for vaccine, right? So Mississippi is a rural state. If we didn't do rural, we wouldn't do hardly anything. That's why we have so many drive-throughs. They're distributed in places like Coahoma County, right? Or Sharkey-Sequina. So even in addition to our normal, or to our commitment to health equity, a lot of our efforts have been devoted to that. So don't just look at the drive-throughs, although that's an important piece. look at our website on the other places, the pharmacies that have been chosen, and also the clinics that have been utilized to get them to those communities. And Victor, I'm sorry, you go ahead.
No, I think that works perfect. And what we talked about earlier, this is just to augment all the other efforts that's already currently taking place. And so, and this is just to make it available and make it an easy choice, and to also deal with some of the other factors and other partners. With us doing this partnership with community health centers, we're able to work with community groups and other organizations that may be able to bring down barriers as far as transportation and other issues. And that's what we're finding out, is that we're working. No one knows the community better than folks that reside in that community and the people that live, work, play, and worship there. And so working with those particular parts of the community gives us another chance to reach some of the folks and make it a little bit more available. A lot of our effort is going to be after hours. A lot of our effort is going to be on weekends, non-traditional times. And so, and we're going to, and even non-traditional places, we have the opportunity to go to housing units and set up there and focus on camps of those particular individuals and homebound individuals and so forth and so on. So again, this effort is just to augment the work that's currently being done and offering another avenue to help vaccinate and make vaccination easy and accessible.
Okay, thank you, Dr. Sutton. Rachel from Politico, talking about the Johnson & Johnson shots over March. How is it being deployed, the J&J shot, and how much has been administered? Do we know, and did we put it out all at once? I thought I heard you guys say we had got a little bit in this week, but Dr. Byers, you're shaking your head.
Oh yeah, we got very little in this week, and really, we're getting a very small allocation of Johnson & Johnson right now. Any doses we get are appreciated, and the demand has been high among our providers, and we're getting that vaccine distributed out to them. And when we got that initial allocation of 24,000 doses, we did send that out to the providers who wanted it and were willing to take it. And so we sent that entire allocation out once it came in. We're not holding back any doses. When they come in, they go out to our providers or to our drive-through clinics and to our other partnerships. And we've administered, I believe, about 20,000 doses of the J&J that have been reported into our system to date. I anticipate that number to increase, and we're going to be providing those numbers by vaccine type on our website soon. So stay tuned for that.
Okay, let's see. Scott Simmons, some have tried to register 16 years old to get the shot, but were told the criteria had not been updated yet, and could they be put on a shot appointment? I think, Jim, you went over that, and an appointment needs to be made through the hotline. Is that correct, Jim?
That is correct. And of course, today was really the first day of that. So the hotline conversion process was complete this morning. So if they haven't called recently, now is the time to call and get those appointments.
Okay, thank you, Jim. Has the department seen efforts to drive across state lines to get vaccine in Mississippi? And how feasible is it to police residency? We do not police residency. If you live or work in Mississippi, you are eligible to get the vaccine if you meet the eligibility requirements. And you would actually be surprised about how many more people actually have gone out of Mississippi to get their vaccines, especially in Louisiana, than Louisianans who have come here. But no, we do not police that. We have no barriers to getting your vaccine. Charles Jones, a recent Associated Press poll found that 42% of Republicans say they probably will not get the vaccine. With the state's large GOP contingent, combined with the hesitancy in the Black community to get the vaccine, are you worried about how many Mississippians will get vaccinated? What will it mean if we get stuck at 50 to 60% rate of vaccinations? Who'd like to take this?
Yeah, I'll kick it off. I think the question's more complicated than that. If we really want to look at the impact of the vaccine, where is it going to be most effective? It's going to be effective in people 50 and older, especially 65 and older, where we see a lot of the death and hospitalization. And we've seen phenomenal uptake. We're pushing 60% vaccination or 75 plus. So I think if you broke it down by age group, it might tell a different story, right? So if we have multiple gates we want to get through, if we can vaccinate vulnerable folks, we've accomplished something phenomenal already, right? So that's got to be job number one, and that's where we started. Now that we're expanding it to all age groups, there is a great personal benefit for everybody getting vaccinated. We know that it's going to be more safer to do the normal stuff we want to do. You're going to protect your family members. You're going to keep from getting ill. You're not going to have to quarantine. That's going to be huge, right? If you're in college and you're vaccinated, you're exposed, you don't have to get quarantined. Look at the benefit of that. So there's phenomenal benefits. That there's reticence, that's okay. People ask questions. A lot of our work with the hesitancy in the African American community, a lot of it's just answering questions and making sure folks understand what's going on and have an opportunity to ask those questions. And if it's anybody, any part of the population, that's what we need to do. So we actually have recognized that the rural population is rurality may be a risk factor for hesitancy. There are probably special efforts that need to be made to reach folks who live in more rural parts of the state. And I've been in contact with some universities in the state who are working on this already. So expect more to come. We want everybody to be protected. And I think that we'll find success. I think when you get to present the information and people can make their own decisions, we found that to be overwhelmingly successful.
Thank you, Dr. Dobbs. Shalini, I think we already talked about the hospital systems and the centers of excellence. If your questions weren't answered, just write me back and I'll make sure that it is. I think we already touched on that. Let's see. Andreas from WLOX. Since younger people are less at risk of going through the worst of COVID-19, some of them aren't as excited to get vaccinated. Is there any plans for PSAs or campaigns to get the younger people signed up? So as the communications director, I will tell you, we are focusing on other populations right now, and partly because of what you just said. We are really focusing on those at-risk groups, those with chronic illness, those in the at-risk populations, those 50 and older that tend to have the bad outcomes, so to speak, whereas the younger people can, but they typically don't. So right now, I don't have a campaign for that. As we go down the road, I'm sure we will. Okay, Kingfish. Creating a statewide distribution system from scratch, was it reasonable to expect vaccine distribution to run smoothly at first?
That's a really good question because, we didn't get an EUA and then 4 days later, we're supposed to give it out, or even like a day later. So this is, in a lot of ways, this is unprecedented. Hey, say, we're not going to tell you how do you give the vaccine, except for when we tell you, you got to go immediately. So there was a little bit of, having to make sure that we could build the system around the vaccine and the storage parameters and the shipment and all that kind of stuff. So it was a bit of a challenge. But I think one of the things that I think have been erroneously assumed about it getting off to a slow start is because we gave all of our vaccines to the long-term care partnership. It seemed slower than it would have been because a lot of it was devoted to the nursing homes. Once we kicked off our drive-throughs, they were going well. I think the hospitals actually got off to a pretty good start. I think there was just such phenomenal demand. As you can imagine, you had 0.1% of supply for 100% demand, and it was a severe mismatch. So certainly it was a challenge, but I think our teams and our partners have performed well.
Jim Craig, anything to add to that?
Yeah, the only thing I'd add is, we're blessed with some great teams here at the health department that have been planning for emergency preparedness work for quite some time. And one of those that we did plan for and utilize were drive-through locations for flu shots. And we did that to really practice how we would do drive-through operations for a number of years. Not at the scale that we're seeing now, for sure. But I think that did help a little bit in our distribution process of getting our state and county drive-through locations set up.
Dr. Byers, do you have anything?
No, I don't have anything to add. Thank you.
Dr. Sutton? Okay, thanks. All right, Dan Gallo, I've already answered the recording privileges, and I will get with you later for the live shot that you wrote about. Andreas, I believe we have answered this about the minority communities. If you have something more specific, please write me back. Kobe, is there anything other than more vaccine doses the state may need to keep vaccinations up or do more? Jim Craig, why don't you take that first?
Well, I think one of the areas that we got plenty of opportunity in is in our homebound. And I know Dr. Sutton's working with his team on part of it. We're working on part of it too, so that we can come up with additional solutions for the homebound. We have local decision or local plans that are working pretty effectively, where churches and local governments and others have addressed this and been able to find some solutions. But an overall strategy for individuals who just don't know where to start the process if they have a homebound loved one is something we need to work on some more.
Anybody else?
Just to echo that, you know, we've been talking to Mississippi State Department of Human Services, around some of their congregate meal sites and working with the AAA's, area agencies on aging to come up with some solutions. So we know this is probably not a one size fit all, but a number of different opportunities that we have in various communities, and all communities are a little different. So we're trying to get at it through a number of different vehicles, and so we're going to press on with that.
Okay, thank you, Dr. Sutton. Anyone else? Okay, Will Stribling has some questions from Mississippi Today. When the state first started receiving shipments, MSDH said it was not going to require a photo ID to get a COVID vaccine to prevent the barrier to access it would cause for people without a driver's license or undocumented populations. We have gotten reports of photo ID being required at some drive-through clinics and not at others. So first of all, we do not. The Mississippi State Department of Health, our drive-through sites do not ask for any kind of identification. And certainly if there's a mixed message going on out there, because there's a lot of people who will need to address that, and we have from time to time, but we do not ask for ID. Protocols in place to accommodate someone who might show up to their appointment without an ID. Again, not an issue. We are not a barrier in this state. If you live or work in Mississippi or meet the eligibility requirements, we want to put a shot in your arm. Ellison Barber, to everyone, let's see. Only 11% of Mississippians have been fully vaccinated per the New York Times tracker. I don't know what time point that was. Are you confident all high-risk individuals, be it seniors, people with pre-existing conditions, frontline workers, etc., who want to get vaccinated have been able to? If yes, can you walk us through the data that led to that conclusion? If no, why risk restricting their supply when the total vaccination numbers in Mississippi are lower than dozens of other states who haven't opened eligibility this widely? Dr. Byers, do you have the latest information? I mean, I thought we talked about that in the beginning of the press conference, did we not?
Well, and you know, the number is true. About 11% to 12% of our total individuals have been fully vaccinated in the state. That's comparable with many of the states around us, and we anticipate that number is going to steadily increase. We did share some data, I think, at the beginning that indicated the success that we're having vaccinating those age groups that we feel are very vulnerable, especially the folks 50 and older, even more so the folks 75 and older. But we still have a ways to go. Has everybody who needs to get vaccinated yet? No. I think, you know, we still have some progress to be made. You know, one of the things that we continue to do in our drive-through clinics is prioritize those individuals who are most vulnerable, prioritize those people 50 and older to make sure that they have a place to get a vaccine, and make sure that we can get them in. And as long as that demand is there, we'll continue to do it. I think we need to continue the work though, and we still have a long way to go. You know, our vaccine allocations are increasing. I think the time is right for us to continue to open it up and utilize that vaccine moving forward. But certainly, I want Dr. Dobbs to jump in and provide some additional thoughts as well.
No, I agree entirely. I mean, if you look at our older folks, I mean, if you look at who dies and who gets hospitalized in Mississippi, and it's almost entirely, but not 100%, people 50 and older. And if we look at our deaths, the proportion of it is super high in 65 and 75 plus. And so we're making really great progress in those age groups. So am I confident, you know, that we're where we need to be? Of course not. We got a long way to go. But we have other tools in our tool chest, right? So the doctor's offices are giving it to their elderly patients, and that's what we need. We have a special allocation of drive-through appointments for people who are 50 and older so that they don't get boxed out, you know, by younger folks. So we do have a way to go, but also, you know, although we've opened it up, we already have from the old criteria, you know, over 100,000 booked appointments that are waiting for people to come in. So there are people who are already sort of in the process who are going to get vaccinated even before the new groups come in. So no, it's time. We have some geographic variability and availability, and we need to tap that demand where it is so that we can reach maximum impact as quickly as possible.
Thank you. Dr. Sutton, did you want to add anything? Good. Okay. Thank you, Dr. Sutton. Will, I think we have answered the next question. Write me back if you didn't get what you wanted about Johnson & Johnson. Kobe Vance, Mississippi is only the second state to open vaccines completely. The president set a goal for May 1st to reach this mark. What are your thoughts on the state being this early? And could the state begin to see more of a vaccine tourism? Now, that is a word that I have not, I think I know what that means, but Dr. Byers, why don't you start with this? So actually, Dr. Dobbs, you worked with the governor. Why don't you take this first?
Yeah, the vaccine tourism thing, people come from out of state, and we monitor that and make sure there's no, and we've talked to the states around us, and you know, as far as like showing IDs, their policy is similar. You know, they don't have to show IDs, so we're trying to have, you know, parity with what's going on with those guys. But if you look at on balance, are more Mississippians getting vaccinated elsewhere versus elsewhere getting vaccinated here? You know, we're not coming out on the bad side of that. So we'll watch it closely, and if it seems like there's something going on, we'll have to address it. I think it's really, I think a single story makes people get all worried about it, but when you look at it in the totality, it's good for our region. Although we still want to do Mississippi folks. And as far as the thoughts about the state being so early, you know, it's time to get as many people vaccinated as possible. We have, you know, we got a lot of vaccine out there. We got a lot of appointments already scheduled. We also see a pretty good horizon of expanding supply. So we need to sort of, it's almost like surfing, right? We want to get ahead of the wave so we can ride it. And so we want to make sure the demand is there. We don't want to waste a week of a vaccine sitting on a shelf when it can be inside somebody, preventing transmission and keeping them out of the hospital. So we're just trying to maximize the resource, and I think now's the time.
Okay, thank you, Dr. Dobbs. JTV, what is the hotline number for a vaccine drive-through? I think is what you're asking, or is it to schedule an appointment? Jim, do you have the hotline number off the top of your head?
I do. It's 877-978-6453, and I just put it in the chat for everyone.
Thank you, Jim. Shalina, which community health centers are partners? Our centers of excellence are on our website, and they agree to do certain things for us, including reaching our at-risk populations. And all of our providers are also on our website. And Snapes to everyone, and with the Meridian Star. Do you know when county level vaccination data for different racial groups become available? Well, I think we have a lot of good data now. Paul, we have a lot of good data that was just added.
Yeah, so we're going to continue to add data. I don't know the exact time frame. We're working on the ability to be able to to provide the racial administration data by county. There are some other things that we're working on adding to our website as well. So just keep checking back with the website, guys. We're gonna keep updating it, just like we did with the case information and early on our website. We're gonna keep, adding and expanding the data that we present on our website for vaccinations. So just stay tuned.
And Liz, can I jump in for one quick second?
Absolutely.
Yeah, I was going to go back to the question around community health centers, our partners. I think they're all our partners and have been working with the agency in some form or fashion, but particularly with the mobile unit piece, we're starting off working with 6, and that's going to be Aaron Henry, G.A. Carmichael, Family Health Care Clinic, Jefferson Comprehensive, Community Health Centers, Outreach Health Services, and Coastal Family Health. And that's who the health department is partnering with, the mobile unit. And that's just as what we're doing to get started.
And we welcome more, don't we, Victor, for the future?
Absolutely. Yeah,
Yeah.
we're just starting there, but we're going to be reaching out to others as well. And some are already doing some of the outreach and community work as well.
Okay, thank you, Dr. Sutton. Kelly Cook, we noticed about a 10,000 drop in total vaccine doses administered last week. I think we've touched on, Thomas, you're shaking your head. Why don't you just repeat that?
It's the same thing. We had a backlog from the ice storm. We had to get all those processed. And then, and they also delayed vaccine delivery, right? So they gave us a whole bunch more. So we basically had 2 weeks stack up on one another. And then we had a big bolus of Johnson & Johnson, 24,000 doses in 1 week, and then we got 0. And then we got about 3,000 for this week. So it's just sort of like a clumping of vaccine supply around those 2 weeks.
And it'll be kind of the same thing. If you think about tomorrow, there are about 13,000 appointments scheduled for tomorrow that we'll be rescheduling. Some of those will be able to service in the current week. Some of them may be early next week. So the numbers will change just a little bit based on when the reschedules are.
Okay. AP wants to know, Leah, do you have numbers on how many people signed up for a vaccine appointment today after appointments opened up to everyone? The only person I can think of that might have a tidbit of information on that is Mr. Jim Craig.
Yeah, there's always somebody in the appointment system making an appointment anytime you look at it. That's the problem of trying to get numbers. But indications are in the first, and I looked at it before noon, and before noon, about 3,500 people were making appointments or had made appointments since this morning.
Okay, thank you, Jim. What Kingfish is asking, what are complaints you hear from your peers in other states about their vaccine distribution systems? Have they contacted MSDH to improve their own distribution systems? Well, Kingfish, we do it the best. Jim, have you talked to anybody?
We have a peer group in Region 4, which are the 8 states in the southeast part of the country that get together every Friday to talk about a number of issues, and vaccine administration obviously is one of them. And we share our stories and share how we're doing things and learn from each other. That helps, I think, overall in the region for those type of activities. And we have been contacted by some of those states to better understand how we're able to use the Mississippi National Guard in our state drive-through vaccination locations, and some of the nuances of how Mississippi's doing the double line production for about 1,000 shots per day in most of our locations.
Thank you, guys. Do you want to add anything to that?
No, I think you covered it.
All right. I think we've already talked about Pfizer vaccines. Andreas, just write me back if we didn't cover exactly what you want.
I did. Liz, just to clarify that right quick, the Pfizer vaccine, as I mentioned earlier, is not currently available in Harrison and Jackson counties this week, but starting next week, Pfizer will be available. So 16 and 17-year-olds making appointments, they can begin receiving it as early as next week.
And let me add on that Singing River and Memorial Gulfport have been receiving Pfizer. So, we're not the only folks, and they've been very, very active in their operations too.
Yeah, that's a good point. We're not the only ones that are administering it. Remember, y'all, there's a lot of providers out there now. Kelly is asking from WMC, the hotline number for churches and other community partners to call if they are interested in helping Dr. Sutton. What can you say?
Yes, that's the hotline number. And if they'll call the number that Jim just gave and put in the chat and hit #2, they will be asked for their name, contact information, email, possibly organizations that may be represented, and we'll follow up with them.
All right, thank you. So I do not see any last questions in here. So at this point, I'll do what we normally do and just go around the room and get some last comments. Dr. Byers, you're first on my screen.
Thanks, Liz. And I think, today and the information that we've talked about is a great illustration of the progress that we've made, both with our vaccination efforts and targeting the vulnerable, but also with showing that our cases are declining, our hospitalizations, our ICU and ventilator use have improved related to COVID. So these are all great indicators. But now is not the time to sit back yet. I think it's important for everybody to still have in place those measures that we know that we've talked about now for months, for almost a year, to prevent transmission. And that's utilizing a mask when you're out in public, smaller gatherings, continue to physically distance. Let's keep those measures in place, and let's keep transmission down. And everybody's eligible for a vaccine now. Now's the chance. Take the opportunity. The sooner we get everybody vaccinated, the better.
Thank you, Dr. Byers. Mr. Jim Craig, we do have a question from Patrick McGee. Will people have multiple vaccine options to choose from at each site? I think we do at some sites have options.
So your first dose is usually determined by the site that you go to. Again, if you go to one of those sites that I listed with Pfizer, you'll receive a Pfizer. Where the multiple selection kind of comes in is that if you're getting a second dose and it was at a location where, let's say before we were serving Moderna as the first dose and now it's transitioned to Pfizer, for a period of time, we do have second doses. It will be second dose appointments that could be Moderna or Pfizer. So it's not where you get to really choose what vaccine through our state drive-through sites. If you're really looking for that type of choice, you may want to seek some of the local providers or your pharmacy.
And any closing words for us, Mr. Craig?
Yeah, just a couple things, thanking the team, the health department team and the guard team that are out there working these drive-through locations. And also just a reminder, listening to the National Weather Service right before this call, the severe and dangerous weather tomorrow looks to be pretty impressive as far as what we will see, maybe similar to what we saw a few years when we had quite a few tornadoes impact our state. So be very, very important for everyone to stay safe tomorrow. Again, just a reminder, our state drive-through locations will not be operating tomorrow because of this dangerous weather.
And the county drive-throughs as well, right?
That's correct. This is the state and county drive-through locations.
Okay, thank you. Thank you, Mr. Craig. Dr. Dobbs, last words.
Well, I want to just really highlight the phenomenal work our teams have done in health equity. We have now reached parity with the African American population in the state of Mississippi. It actually surprised me how well it's come together. 38% of vaccine doses last week went to Black Mississippians. I just want to thank Victor and his team for the fantastic work they've done. All the church leaders, the leaders in the Black community, the African American physicians and nurses who helped us go forward. We've got a long way to go, but I think this is just demonstrates the power of coalitions, the power of partnership, the power of having the vision to get us across the finish line. And I'm just so very thankful. The last thing I just want to say is, we've been through a year of misery, and we have an exit. We have an exit door, and it's called the COVID vaccine. And it has a phenomenal safety profile and a magnificent efficacy. So now's the time for you to get vaccinated. It's time for you to get your kids vaccinated if they're 16 and older, your neighbors, your parents, your aunts and uncles. Let's get everybody protected so that we can get past this thing and move on to the productive, prosperous lives that we all want to lead.
Thank you, Dr. Dobbs. Dr. Sutton.
Yeah, I would just add, I think that was a great note to end on, but, and that's what I wanted to focus on is our partnerships. However, this group can get the word out about the partnerships that we have in place, expanding those partnerships, and this really new vehicle to work in communities and go into communities and vaccinate, make it really, really easy for those that may be on the fence, but if you put it at their front door, then, it's hard to turn down. So just really excited about that, and just really honored to work with the team that we have here at the health department, the committed public health folks and partners around this effort. So again, just excited about working at the community level and having these community events to augment and supplement the work that's already the great work that's already currently being done around the state.
All right, thank you to all of you, to the media. We always appreciate you, and we will look forward to speaking with you all soon. Have a great day.